Welcome to Local Discovery Spotlight on Health. Today we go inside the beautiful Central Maine Medical Center in Lewiston. I'm Tori Ryden. CMMC not far from the rushing waters of the Androscoggin River, flanked by the magnificent Cora Temple and a stone's throw away from the esteemed Bates College. From the award-winning Central Maine Heart and Vascular Institute to the Orthopedic Institute of Central Maine, where brand new techniques are being performed, to awe-inspiring stories of weight loss at Central Maine Bariatric Surgery Center, CMMC boasts world-class doctors and caregivers. But don't just take my word for it. In the next half hour, you're going to hear amazing stories from patients who say they learned firsthand what CMMC can do for them. Some of them say the hospital has saved their lives. So stay with us for this edition of Spotlight on Health here from beautiful Central Maine Medical Center. You've heard it before, when you have a heart attack, every second counts. And for Nick Riggio, the decision to have the ambulance take him to CMMC in Lewiston truly meant the difference between life and death.
I was prepping for a doctor's visit that morning, and as I was in the shower, I felt this tightening in my chest, which felt odd, but not odd enough. So when I got out of the shower, it started getting tighter and tighter. And I called my wife downstairs. I said, Marianne, there's something happening. You need to get up here. And I laid down on the bed, and she came up here, and she's a CNA, so she has some nursing experience, and she said, we need to call 911. At this time, I just had this terrible chest pain, so that's as far as it was. He said, we have two choices. He said, we could either take you locally to the local hospital and be stabilized, and then we can take you either to Portland or Lewiston to the heart facilities there. And I said, well, what would you recommend? I've never had this happen to me before. And he said, we would recommend CMMC because they have an excellent cardiac section there. And he wheeled me directly in. There was no waiting whatsoever, very little talk and everything else. He set up two television screens right above my head so that we could both see them. And he put this catheter in, and then he injected a dye. And you could see where the dye stopped moving, just a couple little spidery lines coming out where it was heavy at first and almost down to nothing. Through the catheter, he must have drawn out this clot, whatever it was that was stopping my blood flow. And as soon as he popped it out, it looked like the 4th of July to me. Everything just popped wide open and the blood was pumping everywhere that it should have been, and which I found amazing. And I could see it right on the screen as it was happening. And I was talking to the doctor too. It was just like we're talking right now. And then he told me he was going to insert a stent. He did the stent, and we were in and out in almost no time at all. I don't think we spent more than 25 minutes at the most in that room before I was in my bed at the hospital. I just felt so comfortable being there, and happy when I left because I felt great.
When a patient arrives to the hospital who's having a heart attack, and the diagnosis has been made in the field, for example, with an emergency medical crew that has the capacity to do an electrocardiogram on site before the patient arrives at the hospital. The cardiac team has hopefully already been notified about a patient who's about to arrive. The physician has been notified, and plans are being made to take that patient directly to the cardiac cath lab, this place, in order to stop the heart attack.
Mm-hmm. And literally you pull the clot out?
Well, sometimes we pull the clot out, but basically we open up a blocked artery, and that generally involves stretching open the artery where the blockage is. Some arteries can be closed with a very tiny amount of clot, and you really can't pull out a significant amount of clot. Other arteries, depending upon the size and the anatomy of the artery, might have a considerable amount of clot there. And in those cases, we use various devices to basically suction out part of the clot, but almost always have to fix the artery where the clot occurred by putting in a device called a stent.
You're doing amazing things here. I mean, you're saving lives every day.
Well, it's very satisfying work to do that, and it is done, of course, all over the country.
Intervention being really the key word here for you.
Yes.
Okay, thanks, Dr. Phillips.
When your heart speaks, listen. If you experience the symptoms of a heart attack, don't wait to take action. Call 911 and please don't try to drive to the hospital. Our EMS providers are trained to diagnose heart attacks on the scene and notify the hospital prior to your arrival. CMMC has the first accredited chest pain center in Maine, and our patients have access to advanced cardiac care provided by the caring, compassionate staff of the Central Maine Heart and Vascular Institute, Maine's newest and most innovative cardiac center. The Arbor House offers caring support for the families of patients, and after surgery, cardiac rehab helps patients recover and return to a happy, healthy life. The Central Maine Heart and Vascular Institute in Lewiston, Maine. Specialized care for the heart, from the heart, close to home.
CMMC gives families in the third floor waiting area a nice respite, a garden filled with trees, and a real nice homey atmosphere as well. And on the first floor near the cafe, you can check out the CMMC Women's Hospital Association's rotating art gallery featuring the works of local Maine artists. From heart attacks to car accidents to other medical emergencies, this is where some 50,000 people wind up every year, and it's a brand new emergency department. Joining me right now is the Director and Supervisor of Nursing here in the Emergency Department, Peggy McCrae, and it really is something, this whole new emergency department. I guess what's the reason for it? It's beautiful.
Yeah, you mentioned it, 50,000 visits a year. We were in an emergency department before that only could accommodate 25,000 visits, so we needed to expand to have the rooms available for the patients that we need to see. It really was to ensure that we can provide services to not only the Lewiston-Auburn area but all of Central Maine. And part of the issue with our emergency department was not only the bed size that we had before, but what's the setup. We now have individual rooms for every patient, so from privacy, confidentiality, infection control issues, comfort for patients and families, they can go into individual rooms and be comfortable during their visit. No one wants to stay a long time, but at least if you have to stay during the process of being cared for and us trying to diagnose, we want to make sure it can be as comfortable as possible for you.
It's beautiful, and it's also really quick. A lot of people praise CMMC for getting people in very, very quickly.
Yeah, we really tried to change our processes, not only with the new emergency department with new rooms, but also look at our processes of how we can get patients back in front of the physician, because they're not necessarily here to see me, they're here to see the physician. So we've done a lot of work with our teams to see how quickly, try to get them in front of the physician as soon as possible.
And speaking of physician, we're going to go talk to Dr. Oliver right now. So thank you so much.
Good.
It's beautiful here.
Thank you.
And joining me now here in the Trauma Center at CMMC is Dr. Lanny Oliver. Really nice to meet you, Dr. Oliver. This is really amazing. Everything brand new. Tell me about a trauma center. What is it used for?
Well, the big piece is we're part of the larger puzzle here in the state of Maine. There are 3 trauma centers. We're one of 3. Portland and Bangor have the other 2. And it's a big team approach to the management of trauma patients. We've got a team of trauma surgeons and emergency medicine physicians that form the core of that team, and you're in the trauma center.
And who is a trauma patient?
Trauma patient, anybody with a serious injury, potentially life-threatening injury, those are the types of patients that would be brought here.
Okay. So Life Flight factors into that as well. It's a helicopter that brings people here to the trauma center, right?
Yes. Life Flight's a key portion of what we do. Life Flight shortens the distances for patients traveling throughout the state of Maine. So our patients come to us from central Maine, but also western Maine and New Hampshire. So travel times are particularly a problem in the winter, so air transportation shortens those distances for us.
It takes a special person to be one of those pilots, doesn't it?
It takes a special person to be a part of the any part of that crew, which is the pilots or the nurses or the medics.
I mean, they are the first group that gets a hold of the patient.
They're frequently the first responders. Life Flight will land places that ambulances don't have access to, so they'll pick up patients right at the scene. And other times they'll pick up patients that are being transported by ambulance. What they'll do is they'll meet them en route and shorten the ambulance transport times.
And what they get started, then they hand off to you.
That's exactly right.
So how critical is Life Flight? Well, every year between 2 Life Flight bases, they take 1,500 patients on LifeFlight missions. And joining me right now is a LifeFlight nurse, Sam Schaub. Nice to see you.
Likewise.
You are a very busy guy, 1,500 flights.
Yep, we fly all over the state of Maine, as well as we transport throughout New England.
Tell me some of the people who you're transporting. What are they afflicted with?
Well, we fly a large number of cardiac patients. We also fly a fair amount of traumas, neuro patients, as well as specialty services for pediatrics or other such things.
Stressful job?
It's pretty intense. You know, we have a lot of training before we get started on here, and the whole crew is very dedicated.
And I know on board you have everything that you need.
We basically have all the same equipment that they have in the intensive care unit as well as in the emergency room, so we can take care of patients ages from 2 days on up all the way up to 100 with any sort of medical or trauma problems.
I know you're highly trained. You're not a doctor, but you really actually have to kind of act as a doctor on board this.
Yeah, we operate under the guidance of a clinical practice committee, which is a group of about 15 doctors that oversee what we do. They provide the training and the resources for us, and then we're able to make all those decisions and do a lot of the same procedures that the doctors are able to do in the emergency room or in the intensive care unit.
When someone has a stroke, what do you do?
The biggest thing is to get them to a certified stroke center in a very timely manner. This helicopter goes about 170 miles an hour, and so we're able to go from point A to point B in a very timely fashion. In addition, we have all the medications and machines in order to keep them stabilized throughout the transport.
Sam Schaub, you've got a very important job. Nice to meet you.
Thank you.
Thank you
Likewise.
very much. And I am joined by one of the very first people who was on board the LifeFlight, Carl Grove, who's the Director of Pharmacy here at Parkview Venice Medical Center. And Carl, you were in this very office. You had a stroke a year and a half ago?
Yes, I did.
They took you on LifeFlight. Tell me about that.
Well, one of the tests that I needed here wasn't available soon enough, so that decision was made to take me on the helicopter to Lewiston. What I recall of it was that it was very smooth. You know, they wheeled me out there. Everyone was very professional, and it was very quick once they got into the air. I don't know how many minutes it is, but it's very quick, 7 or 8 minutes. So the whole thing might have taken a half an hour to get me out there, get me on the chopper, and then get me out again. At the point that I was being taken out, I don't remember a whole lot, unfortunately because of the stroke, but my wife was with me, and you know, she said it went well, obviously. I got there and got there quickly, so it was good.
I mean, it really saved your life.
Yeah, it made a huge difference, it really did. Yeah.
You feeling good now?
Yeah, I do. I feel well, so I'm lucky.
And new to CMMC, stroke patients now brought into the hospital have access to some of the world's top-level stroke experts thanks to a new deal with Mass General Hospital down in Boston. Joining me now to explain all of this is neurologist Dan Bobker. How does it work?
Well, let's take a moment to talk about what the problem is. When a patient has a stroke, a blood clot forms in the brain, depriving the brain of oxygen. In the past, we've had no way of treating that. But in the last 10 years, there's been a treatment called TPA, or tissue plasminogen activator, that can dissolve those clots. The catch is the TPA has to be given within 3 hours of the onset of symptoms. So that works well at a big university hospital where there are doctors in-house all the time. But at a smaller community hospital, we don't have doctors on site around the clock. That's where the teleneurology comes in. Teleneurology lets us have access to a Mass General neurologist within 10 minutes of the onset. And they can walk through the process with us, and we can give the TPA drug within that time frame we need to.
Which is where this television screen comes in.
Correct.
Teleneurology meaning television, so they can actually see patients here?
Right. A patient will come into the hospital here. We call Mass General up, and within 10 minutes we have a stroke neurologist on the line. They can see the patient can see them, and we can go through the process of seeing if they're appropriate for this clot dissolving drug.
That's really amazing.
Yeah, it's a great new development in the field.
It's good for you guys, it's really great for the patients because it gets them exactly what they need immediately.
Right, there's no delay trying to get all the doctors assembled. We have the doctor online within 10 minutes.
And also it means that probably patients will be healed quicker?
They can get the drug they need in the time frame they need it within that 3-hour time window.
Wow.
Yeah.
Teleneurology saving lives here at CMMC.
It's a great development.